Yes, better.
Well, I'll just get started. I want to thank Dr. Delaney and Carla for inviting me to present today, and I'm very excited to share some of the work that's happening in LA County around increasing access to healthier food and beverage options. We'll go to the second slide. Sorry. Okay.
It's very sensitive.
Okay. So thanks again. And I thought what I would do today is twofold. First, share sort of the process, how we got started in this work, share a little bit about our experience with operationalizing nutrition standards and other procurement practices in government departments and programs, and then present some early lessons learned and preliminary findings of our broader healthy food procurement initiative. I'm going to see if this works. Here we go. So I just wanted to start sort of with a broader definition. What is healthy food procurement? Food procurement encompasses the process of procuring, distributing, selling, and or serving food. And governments buy food and beverages for a range of programs, whether it's for our jails or our probation camps, for school districts, also purchasing food to sell to employees in the public through retail outlets. And typically, governments purchase through a competitive solicitation process. And typically will contract out to food service vendors, our larger food service corporations. And it's in the solicitation process that we can build nutrition into the institution's operational process, including three different policies, including nutrition standards, food purchasing standards, and environmental strategies. And I'll sort of define all three of these. Nutrition standards are codified limits on calories or saturated fat or sodium or trans fat. And food purchasing standards are specific, they are requirements that adhere to these limits, but typically include other institutional considerations around costs or locally grown. And to give you an example, if you're talking about our county facility, I'll just name a hospital, and they're looking to purchase canned vegetables. We would set a purchasing standard that would potentially limit the sodium around our canned vegetables that we're purchasing. Or we would set a standard that says we only want to purchase fresh fruits and vegetables. That's sort of an example of a food purchasing standard. And then the third piece, as far as integrating this into our solicitation process, would be environmental approaches. And what I mean by this is strategies that we can implement to increase the selection and the consumption. So getting our patrons and our consumers to actually select the food and purchase the food. And this could be a range of strategies, whether it's product placement, placing fruits and vegetables near the cash register, or it could be menu labeling, or it could be just simple signage in various government institutions. So what are the broader goals of creating healthier food environments? I think the most obvious is to increase access to healthy food and beverage options and making the healthy choice the default choice, improving food quality, and then most of us around the table are large government institutions that have a tremendous amount of purchasing power. Additionally, supporting local economies and encouraging our institutions to purchase locally, so we're keeping our dollars in our county environments and keeping those dollars within our local economy. And then most important is improving the health of our employees, our community members who access our government programs and our facilities. So I thought what I would do is give you some context on how we launched this effort in our county. Back in 2009, our department conducted a broad-based needs assessment exploring, you can see on the top manuscript, facilitators and barriers to implementing a local policy to reduce sodium consumption. And we did a large-scale assessment and interviewed, I think, about 18 different organizations and departments who purchase, distribute, or sell food in our county government. And what we learned from this study was that nutrition was a high priority to our county departments, and also that our county facilities have the authority to impose nutrition standards, which is really key. Additionally, we found that the range of venues across our county government are complex, and they have a range of different needs and considerations, and they all have different contracting processes, different operational processes, and have different barriers to constraints. So what we also learned from our county departments through these interviews is that they were very interested in moving forward on a venue-based approach, really speaking to the needs of our county facilities. Compared to if you look at other jurisdictions who are doing this work, for example, in New York City, who adopted a broad-based set of nutrition standards that would, sort of a blanket policy that would require all facilities to implement the same set of standards. So our department said, we really would like to partner with you on moving forward on a venue or a department-specific approach. So this study really helped build a strong foundation for building our approach in our county. And what we also learned from this broad-based assessment was that there's hundreds of worksite food service venues within county departments, including cafeterias and snack shops. These are some pictures of our environments, vending machines. And in many of these venues, including cafeterias and snack shops, patrons are often residents of nearby low-income neighborhoods. We also learned estimated reach, and you can see our jails, we serve approximately 80,000 meals a day in our jail system to our inmate population. And we recently were able to estimate, and this is a very conservative estimate, that this work can impact 37 million meals per year in our county government. So based on this study that I just talked about, we developed a targeted approach looking specifically at how do we influence and build nutrition into our food service contracts that our departments use to solicit and to contract with food vendors and our contracting processes. And I already mentioned our approach is a venue-based approach. And part of this process, moving beyond just thinking about the contractual aspect, I wanted to kind of give you an idea, sort of the components involved in this. First, and probably the most critical piece, is as you're working with departments on improving food environments, conducting an extensive review of current food standards and policies and practices is key. And I'll give you an example. We work with our probations department, and they're actually regulated both at the federal, state, and local level. By state standards, correction standards, they're called Title 15, and then also our probations department in the county of LA draws down federal dollars for our National School Lunch Program. So we have to look at all of those range of policies and identify through that review what are our opportunities to go further. So the next step is developing evidence-based nutrition standards that work within that current regulatory environment. So I wanted to include a slide to give you kind of a flow chart of a typical solicitation process. And I already mentioned governments use competitive solicitations, whether it's a RFP, a request for proposal, or an invitation for bid. They're slightly different, and I can speak, if folks have questions about that, I can try to answer them, but I won't go into detail. But just to give you the flow, if you're an institution, let's say you are our county of LA workplace cafeteria, you are looking to specify what you're purchasing as far as food and beverages. So they use an RFP or an IFB to do that. And it's really the IFB and the RFP is the opportunity for county departments to influence what we purchase for our consumers and our employees. So that's why DPH recommended nutrition standards and healthy food purchasing practices would be integrated into the RFP or the IFP process. And at that point, the solicitation would include those nutrition standards and healthy food procurement practices, and then proposers submit plans on how they will meet this criteria. And then usually, typically, the next phase is a negotiation between the vendor and the entity or the institution. And then we have a final food service contract that basically sets a whole new level of expectations around nutrition for that institution. Other key components beyond the contractual aspect is technical support and assistance. Site visits have been really important for our department. Menu review, nutrition technical advice, and then monitoring compliance. And I'll talk a little bit about that later in my presentation. and also best practice sharing. And I think this group knows that we're planning, actually next week on June 5th, we're hosting our 3rd annual Food Policy Forum to share best practices around our work, as well as what's happening at the federal level and the state level. So this process that I just described was institutionalized in our county government system by our Board of Supervisors back in March of 2011. And we worked with our Supervisor District 2, who carried this motion, and it was adopted a couple of years ago. It seems like it's crazy, Dr. Simon. It's been 2 years since this was adopted. But this policy basically says that every RFP, before it's released, that the Department of Public Health would review that RFP or IFB prior to its release to ensure that dietary requirements promote healthy nutrition. And I wanted to mention, it's one caveat on the bottom that's just critical to the cost conversation. But the director of the Department of Public Health will work directly with affected agencies to incorporate recommendations to the extent feasible within each contract. And I wanted to point that out just because our board understands that this, cost is an important consideration, and that we really need to work with departments sort of where they are, as well as their priorities moving forward to improve food environments.
Michelle, how many has it been since the passage of this? How many proposals? How many have you had to review?
Oh, I'll talk about that in a second. We work with 5 departments. So 5 RFPs, and we have a couple coming up in the next couple months.
These are big ones. It's not a single cafeteria. These tend to be big groups.
Exactly.
Another question, did you talk about or consider, I know it's bigger and harder, is anything more specific than just nutrition to say, like locally acquired?
Yes, and I'm going to give you an example of how we work in a specific venue and show you some of the sample nutrition standards that we were able to integrate. So just quickly, I wanted to mention that following the adoption of following the motion adoption, we launched an advisory committee to guide our work, and you can see the various organizations. Alexa is one of our advisory committee's members. And then we also conducted another round of interviews with our departments, sort of a broader-based interview process. We interviewed 15 departments, and you can see a range of some of the topics. And I'm more than welcome to share this tool with the Alliance. And it's a good sort of baseline survey that you can use to launch some of this work in your county department. But we looked at, as you can see, we looked at food preparation, the types of venues that we have, and we were able to glean a lot from these interviews, and we're actually in the process of trying to write it up in a manuscript. So hopefully we can share that down the road. I'm
not going for it?
Not going for it.
All right.
So what did we learn? We learned from these interviews that we have 12 departments that purchase, sell, or distribute food. And if you can't see that, I won't name all the departments, but I think a lot of you would know who they are. So that would be our fire department, our sheriff's department, and we have our parks and recreation department with our rec facilities. And you can see we have a lot of vending machine contracts around the county. So these are the types of venues that are impacted by our board motion: our institutionalized populations, our retail environments, our distributed food programs, which includes our senior programs, and we also have, through our Parks Department, we administer our Summer Food Service Program, which is a USDA program, mobile vending, and then vending machines. So here's the slide that shows you who we work with. So over the last 2.5 years, we've worked with our Department of Health Services.
Sorry, guys.
Okay. And we work with our Public Works Department, our Probations Department, Parks and Recs, and our Chief Executive Office. And this is, to go back to the solicitation process, most of these contracts are like 5-year-long contracts. So the opportunities come up when the contracts come up for renewal. So these are really the departments that have come up for renewal in the last 2.5 years. As Dr. Simon mentioned, these are big contracts. The hospital cafeterias, that's for all 5 of our county hospitals. So we're talking huge dollar amount as far as the contract, and I don't remember the number, but it's in 25, 30 million?
Multiple millions.
Yes. It's a huge contract. A lot of purchasing power here. Juvenile halls and probation camps, this impacted our work in all 4 of our juvenile halls, as well as one of our large camps that we have for kids. That's about 11,000 meals a day. And then I most recently worked with our Parks and Recs department to integrate nutrition standards in the Summer Food Service Program, which is a regulated program by the USDA, but we were able to move beyond the USDA requirements and include additional improvements in that food environment. Okay. So here's a sample of one of the departments we work with, and I just wanted to give you a range of some of the standards that were included. So we work with our Department of Public Works, and they have a headquarters cafeteria on site, and they have vending machines in the building. And in the cafeterias, we were able to integrate language that requires their vendor to have 2 healthy entree side options, 2 healthy side options, and then 25% of their snack options have to be healthy according to LADPH nutrition recommendations. So, for example, the healthy entrees have to be under 500 calories, under 600 milligrams for the entree, and I won't go through the rest of the standards. But I didn't put it on here, but water must be priced equal or lower than other beverage options. It's just one of our pricing incentive policies. Integration of signage, purchasing locally grown is encouraged. And then also working on a gradual sodium reduction plan. And we've been able to integrate that language in all of our contracts across all of the venues I mentioned earlier. And then also touching upon beverages and reducing portion size for sugar-sweetened beverages.
So that one is the same thing New York City did that has gotten so much flash. In the institutional setting, no one, well, there was some pushback.
There was some pushback around, just the sizes differences between diet, and was that going to impact cost and selection of the diet drinks. But we've been able to work with them, and we're actually, I didn't include it here, but we have some signage that we're integrating. In a few weeks, we're going to go back to the facility, and we have some nice signage that our communications department has mocked up for us that's promoting healthy beverage options in the facility. And this is an example of a sign that we're going to be, that's going to be put on the wall in the cafeteria.
Can you just say a little bit more about what the gradual sodium reduction plan is?
Yeah. So, a lot of our work in LA County was sort of based on lessons learned in New York City with the National Sodium Reduction Initiative. Through that paper I referenced earlier, we learned sodium is a real challenging area to work on. I think most of you probably would know, given palatability issues, cost issues, availability of sodium products. So we're actually working to develop venue by venue a reduction plan that meets sort of the needs of that department. Basically, and we're actually working on developing that plan right now, and we'll be working to implement that across all of the venues. So it's basically a phase-in process. And I don't know if you've seen the USDA school meal standards. They have a 10-year implementation plan for vendors on how they would gradually reduce sodium in the meals programs within school districts across the country. So it's going to look something similar to that. So we also developed a comprehensive implementation plan, and I won't go through all the steps. Outreach. We also lead environmental scans of all of select environments, and I'll talk about that in a sec. One on meetings with vendors and county departments and technical support, monitoring compliance, and then the advisory committee meetings that we convene quarterly. I work very closely with our evaluation team, which is led up by Dr. Tony Kuo, and they're looking at documenting the potential effectiveness of expanding healthy food options and beverage options. And I just listed a few of some of the evaluation activities that they're conducting, examining compliance, gauging acceptability of changes from the consumer perspective, and then reviewing inventory of foods sold or consumed. And that's looking specifically at sales records, cost records, as well as food production records, and beginning to understand consumption patterns. So I just to sort of begin to close my presentation, I wanted to give you just a couple early preliminary findings. This shows the cafeteria I was just talking about. This is pre and post. This is the old vendor on the left, the menu. And as you can see, just immediately with our nutrition standards, the menu was labeled with healthy entrees, and you can clearly see that there's healthy choices within this cafeteria, as well as the little heart symbol. And we're actually going to be working to integrate our own branding in that. But the vendor early on in implementation labeled without any guidance, which is great, And as you can see, those are the healthier entree options that meet our nutrition standards. And we also conducted last year, we have a county vending machine policy. And then in the same facility, they have 10 vending machines. And you can see immediately with implementation, we doubled the healthy snack environment within those machines. We have some room to go, and we're working with with this department on 100% compliance. We also developed a quality assurance plan that basically identifies the contract requirements, where the vendor needs to go, and we also provided recommendations on how they can meet those requirements. And just last couple slides, I just wanted to mention, these are, I think Dr. Delaney sent this to you guys via...
It's like contraband. We almost couldn't get the document.
I know. There's like copyright issues, I guess, but I'm glad that we were able to share it with you. And these papers essentially sort of share our processes and how we sort of built our initiative and describe early, our lessons learned, more from a process side versus, outcomes, but more of the facilitators, the barriers. And I thought I'd just quickly run through what are some of the key lessons learned. I have already mentioned some of these. The review process is so critical to this work of understanding sort of where departments are now. And then that helps you identify sort of readiness, institutional readiness, and what are the priorities of the institution moving forward. I already mentioned the NSRI, the sodium reduction. New York City's work, what's happening at the federal level, has been huge to move our work forward. Strong partnerships, probably the most important piece on this list, and nurturing those relationships is really important. And then the technical assistance is really critical as well. Just a few barriers and challenges. I already mentioned these departments all have their own contracts divisions, their own stakeholders, their own unique needs and concerns, and there's a huge variance in people's understandings of nutrition concepts, and that's really critical to mention. Some of these departments have dietitians, some of them don't have dietitians, so it's navigating that process, education, trying to build a worksite wellness component into these departments, and then cost, availability, access, acceptability. And then we've had challenges on collecting data, and we continue to try to work with departments on this. These are some of the resources that we're going to have on our website soon, and I'll share these with Dr. Delaney and Carla. And you're going to get some of them next week if you come to our forum. And then just to close, there is emerging evidence and early outcomes that this work is a potentially high-yield, high-impact, sustainable system change for our county and for all of your counties. And we have a potential here for government to really model healthy food environments. So to close, obviously this work wouldn't happen without Dr. Simon and Dr. Kuo, and then our CTG director, Michael Lays, and our evaluation staff. I just want to thank everybody. My contact information, if you want to reach me, and I am more than welcome to answer any questions at the end.
I have a question. You mentioned the pushback, so everybody, when we all know this is a good thing, but people who work in public works or the jail or probation, they may not, maybe just see it as more work for themselves. How did you show them the what did it for me part? How did you overcome any resistance that they might have had to wanting to go that way?
Yeah, I think, and I don't know if Dr. Simon agrees with this, I think that the commitment from our Board of Supervisors,
That was the most important.
I think that was huge. And I think,
said you must do this.
Yeah. So I think with that sort of top-down, that leadership, that position that our Board of Supervisors sort of said, this is important to our county, and we care about our employees, and I recently saw some statistics about our obesity rates, and especially our second district has led a lot of this work. So I think that was huge, of getting departments to really buy into this.
The county's Director of Human Resources has been a real ally because she sees the cost implications of the obesity and diabetes rate in our workforce. She has told our board this is going to be a disaster over the next decade to do something about it.
And how many employees do you have again?
100,000.
And did you, Michelle, I remember in your presentation at Environmental Health, the obesity rates within county employees were...
Yeah, I referenced in this presentation we gave a few weeks ago, the Kaiser Permanente statistics, and I think it's 76%, according to One Health Plan, are overweight and obese. Yeah.
3/4 are either overweight or obese.
3/4?
Yeah.
Obesity much lower, but if you add in the
Overweight, yeah.
I have one question. We attempted to work with our GSA regarding a vending contract. It just came up, and they just put out an RFP, and they assured us there was a health component to it, but there was no specifics to the RFP that went out. So they've invited us to speak before the executive committee. They only had one bid so far, and so we're thinking maybe if we couldn't get in at the RFP process, maybe we could get in at the contract negotiation process. But what we found is that there's so many vending machine nutrition guidelines from different sources. So how did you decide which ones to use? Did you create your own? Because we have we have our wellness program, we have our one of our doctors is on our wellness committee, and a couple of other people working on this, but everybody has a different perception of what the nutrition guidelines should be. We thought we'd go with CDC guidelines. Network for a Healthy California has guidelines. There's a lot of guidelines out there for vending machines. So how did you decide that?
Yeah, and this actually is pre-me in the county, but I know that there was a committee that established, including dietitians, and they looked at all sort of the big urban.
We didn't want to reinvent the wheel either.
Yeah.
I remember we looked at existing guidelines and selected what we thought made the best sense from those rather than trying to.
Well, it's just daunting because there's sodium, there's fat, there's
Remember the schools guidelines were important because we were told by the vendors, if you use these, it'll be a lot easier for us.
Yes, there are.
Yeah.
So ours are
school vending.
Yeah, ours are a combination. I can share those with all of you. Ours are a compilation of the school standards, and Dr. Simon referenced that we got pushback from vendors that they wanted some more standardization, right, around how for implementation. They didn't want to have to develop two different product lines. That there's that standardization. So. We've done a lot of extensive back and forth on these standards. We can share our model.
The other thing we learned, everybody wanted us to do it in a graduated way, 25%, then 50% healthy, then 100% healthy 3 years down the line. The vendors said, a couple of them anyway, said, if you're going to do it, do it 100%. I don't want my workers having to calculate what 25% is or 50%. So did that help kind of facilitate move? I think that helped us move more quickly.
I think so too, yeah. Because the folks, that takes a whole other level of coordination as far as working with the vending. And we had the stickers, Dr. Simon, right? And I think there was even issues around placing the stickers in the wrong categories, and that was a consumer patron problem. They didn't know what they were looking at. And so I think, as Dr. Simon referenced, I think just mandating or requiring 100% food policy, I think, is going to be the best and smoothest implementation process.
A question about the percent that you were able to increase in terms of the healthy purchases on the vending. You've got from the pre and the current sales, and I'm wondering what was the dollar amount too? Did you find a shift on that? Was there a decrease? I know the percent of healthy was higher.
You're talking about the revenue impact?
Was revenue adversely impacted, or how's the revenue been on the vending machines in these places?
We are still, it's very preliminary, we're still collecting that data from departments, and I think hopefully we will be able to share more of that later in the year, but it's probably a little bit too preliminary because the only department that is implemented is the one I referenced, and it's only 10 machines, so it's really kind of a small. I don't know if that would really tell you the story, but we are working with our chief executive office, which is basically the GSA it is basically who are administering our large-scale 550 machines, and actually the vendor is being chosen in the next week. I wanted to mention in the RFP, we wrote in that the vendor would have to provide revenue data to us. And I think that was a barrier and a challenge prior. So we were able to write in monitoring compliance language, which sets an expectation within the contract that the vendor has to share this with the department. And then we also wrote, in the language, it actually says the Department of Public Health will continue to monitor and comply and to report back to the entity that actually is administering that contract. So I think that is going to help us collect the data, and long-term, hopefully, we'll be able to share that story moving forward with all of you.
Thanks, Michelle.